get started. So welcome again to this Public Policy Committee educational session on early care and education, health, and maternal health. I'm going to go through some quick housekeeping items before we get started. So this session is being recorded and will be shared with all registrants. So if you need to jump off early or want to share the content with someone else, you will be able to do that. We will be taking questions through the Q&A feature throughout the program, and then we will pose them to the panelists at the end. So please feel free to drop those questions in as they come to you. And then also feel free to use the chat. We'd love to hear, your thoughts and have a great discussion in the chat. When you are using the chat, be sure to select the correct audience. If you'd like everyone to see it, just toggle to that on the chat. And with that, I'm going to pass it over to Ron McClain, who is United Way of Southeast Louisiana's Public Policy Committee Chair.
Well, good afternoon, everyone. Again, I'm Ron McClain, the chair of the United Way of Southeast Louisiana Public Policy Committee. And I'm really excited and happy to welcome you here today, and also to thank all our participants, particularly our speakers, but for everybody who is involved. And why are we hosting these sessions? So every year, United Way of Southeast Louisiana creates an agenda outlining our priority public policy issues in health, education, financial stability, and community strengthening for the legislative sessions. United Way's legislative agenda advances our fight to eradicate poverty in Southeast Louisiana through the Blueprint for Prosperity by supporting ALICE households. That is those families who are asset limited, income constrained, but employed, the working poor. We focus strongly on public policy because it's one of the most effective ways to drive systems level change in our community. These educational sessions allow Public Policy Committee to gain insight from experts in key public policy issues and to develop a comprehensive agenda. We also collect information on the legislative priorities of United Way community partners who provide critical on-the-ground services to vulnerable populations across Southeast Louisiana. So yes, we gather information from a variety of sources, including those agencies who provide direct services to consumers who are oftentimes funded by United Way of Southeast Louisiana. I'm really excited about today's speakers. We'll have Dr. Libbie Sonnier of the Louisiana Policy Institute for Children, Frankie Robertson from the Amandla Group, LLC, Stacey Roussel from the Louisiana Budget Project, and our own Jillian, Delos, Reyes, and Melisse, Meza, both from United Way of Southeast Louisiana. Now it's my pleasure to introduce Michael Williamson, the President and CEO of United Way of Southeast Louisiana.
All right, well, good afternoon, everybody, and it's great to see so many familiar faces on the panelists. And I'm sure, like a lot of our guests, I'm excited to hear from each of you on this panel discussion today. But my job today is to make the connection between this discussion and ALICE households throughout our region that are struggling day to day. But only through smart policy and advocacy can we help raise up those families and ensure that they can live their lives to be the most prosperous possible. So let me dive in just a second, just for folks that are new to ALICE, and make sure that you know who we're talking about, and more importantly, why. ALICE is an acronym. It stands for Asset Limited, Income Constrained, Employed. I like to consider this a Cliff Notes version of the study on financial hardship. This is a very straightforward way for us to understand not only who ALICE is, but the challenges that ALICE faces. These ALICE households are often slightly above the federal poverty line, but slightly below what we consider to be a household survival budget, meaning they have to make impossible choices each day. And while such hardship is pervasive, it's important to note that households of color are disproportionately ALICE. ALICE also represents the data reshaping the dialogue on financial hardship and our grassroots movement that is picking up steam across half of the U.S. states and counting, meaning over the half of the states in the country are now ALICE report states. But ALICE, as we all know, lives right here in Louisiana, Southeast Louisiana. going to kind of touch on a few key trends that are important to this discussion. Those are trends that are increasing over time, and this should be no secret, but the cost of living increased more for Alice households than overall inflation as measured by the Bureau of Labor Statistics Consumer Price Index. And worker vulnerability, sorry, that's a tongue twister, increased with growth in low-wage jobs and more fluctuations in hours, schedules, benefits, while wages remained stagnant. And the number of Alice households has increased. And while there's been a spotlight on poverty, which has remained flat and is anticipated to drop some in the wake of pandemic aid, the number of households has continued to increase, rising from 22% in 2007 to 33% in 2018. Now, we anticipate the number of Alice households will increase in our next report release, which will be coming out in the not too distant future. But a few things to note about that. Unemployment, closed businesses, and halted production of many goods and services reduced the income of many of our Alice families. And the 12% of Alice households on the cusp of the Alice threshold in 2018 remain especially vulnerable with these circumstances. And the number of households unable to afford household essentials has already been growing over time. Note the percentage of Alice households below the Alice threshold increased from 41% in 2007 to 51% in 2018. Now, how does Louisiana compare? Louisiana led the nation, unfortunately, in 2018 with 51% of households living below the Alice threshold. I think something we can all agree is not only unacceptable, but is not even necessary. And Alice in Southeast Louisiana, throughout the region that we serve, in 2018, 52% of Southeast Louisiana households had income below the Alice threshold, meaning they were unable to afford the most basic budget. The large number of households struggling before COVID-19, the crisis, helps explain why the dual impact of this health crisis and economic disruption was so severe on Alice households. But as you know, West Southeast Louisiana is laser focused on issues around equity. And so let's talk about equity for Alice. Creating equity for Alice means illustrating how barriers by race, ethnicity, age, sex, gender identity, sexual orientation, zip code, health, ability, veteran status, and or immigration status actually limits life outcomes. And working to remove those barriers so that all people can participate fully in all aspects of our social and economic systems is an important part of the work at our United Way and with many of our collaborative partners. Now, through these series of educational sessions, you're participating in number 2, so thank you for being here. We strive to recognize and document the role of structural inequities in the lives of Alice families by doing a few things. One, we're using the best possible data to show where opportunity is and is not available, where it is easiest to fall into hardship, and what structural changes are needed to make Alice individuals, households, and communities safer and more secure. We're also holding ourselves accountable to take an equity-centered approach in our work and calling to attention any actions that run counter to those efforts. And you will see a number of those throughout any particular year that we are both involved in and leading. We're also being intentionally inclusive and widening the diversity of the network of collaborators on our communities without overburdening any individuals or groups. We often say at United Way, many hands make light work, and teamwork makes the dream work. And we're also advocating for Alice, providing research and data-informed strategies and solutions to assist those who are struggling financially to make ends meet, and by shining a light on racist and discriminatory systems and policies in order to affect change. And with that ultimate goal of making sure all Alice households have everything they need to live and thrive in what is now a more modern economy. So that's a snapshot of Alice. I'll note that you see Alice on a daily basis. And so these discussions today are advocating for people that you know all too well. And now it's my distinct honor and pleasure to introduce Mary Ambrose, United West Southeast Louisiana's new Chief Equity and Impact Officer, to walk us through a discussion on equity. Mary.
Thank you, Michael. I'm excited to be here to infuse this equity question in this conversation. As you see, we are centering equity in our work here at United Way. And so the questions from the panelists, especially Stacey and Libbie and Frankie, is so often policies are created without community input, causing harm, especially to the same communities they're intended to help. How are you ensuring you are putting people first, focusing on real people's problems and experiences to uncover and address systemic inequities? And everybody, please share your thoughts in the chat. But we're going to start off with Libbie.
Thanks so much. I think we're going to share my presentation.
I think at this point, kind of responding to those questions, and then we'll start the presentation.
Yeah.
Did you have it in your presentation, the answer to the question?
Mary, would you like to maybe open that up to anyone to respond?
Yeah, we're gonna Stacey or Frankie, would you like to respond to this question?
Oh, I'm so sorry. I didn't realize. I thought you were asking it to anybody that was attending.
No, specifically to you, Stacey and Frankie, and then if the other attendees could put in chat, or anyone else can put it in the chat.
I'd like to jump in there while we're all lining up to answer the question. Thank you for the question, Ms. Ambrose, and congratulations on your new position. Very, very happy to see this work taking place continuously at United Way. So I think this question is really, really spot on, that constantly there are policies created without community input, and those policies do cause harm, especially with the same communities they are intended to help. The best way to solve an issue, or the best way to create policy, is to center the voices of people who are directly impacted. We refer to that as centering in the margins, right? There's no one else best suited to speak for community than itself, right? To share the issues that is impacting that particular community, and of course impacting entire communities, and not what we think is what people need, right? People who are impacted, in numerous ways are well suited to speak up for themselves, to share what their needs are, also even to share solutions. And I know that Libbie is going to be answering the questions, but one of the things I appreciate about the work that she's doing through this phenomenal coalition, Go Far, is that they're one example of doing just that, right? So I think it's just really important to make sure that people are able to speak for themselves, or speak for ourselves, because we have our own solutions to the problems. A lot of times what we don't have is that direct power. And I'm very intentional about saying direct power, because we do have power. We have people power, but we have to disrupt the power imbalances and the systems that are firmly in place, but we do indeed have the power.
Thank you, Frankie. Absolutely, we do have power. It's just how do we bring those voices together and lift them up? Stacey, would you like to answer this question?
I'll be happy to. So Stacey Roussel with Louisiana Budget Project, and a proud partner of many people on this call. Our organization is really centered in doing research and providing some of the numbers and providing the support, but always looking to our partners and the people on the ground that our policies and our work are meant to uplift. So we work in close partnership with groups that have direct contact with community, but so much of our work, we're a smaller shop, is really focused on putting together the case, making sure that it's reflective of the needs, the desires, of ALICE, of the asset limited income constrained population. That's our core group at Louisiana Budget Project. And then making sure that that information, that research, blended with the voices of impacted individuals, gets to lawmakers, gets to decision makers, and gets to them with the right information, the right data, and the stories of the people who are being impacted.
Absolutely. Thank you, Stacey. And Libbie, would you like a moment to share?
Sure. I just totally messed up earlier, but yeah, I mean, I think Frankie's point's well made with the work that we all engage in together as a community, but also fundamentally with the people that are most proximal to dealing with issues at hand. They know their situations best. And oftentimes what happens in policy making is we, and I include me in that we sometimes, is we think we're making the right decisions for other people. And that's not our place. It's not our place to do. And so we work very hard at the Policy Institute with partners on this call with us to really center those voices of families and children. I've never met a family in my 20-year career that didn't want the best for their family. They might not know how, and they might not have the resources, but it doesn't mean that they don't want better. And they need to have the ability, because they have the power and the agency to do so. They need to have the access to the ability to make their voices heard, and for them to be listened to.
Wow, thanks.
Thank you. Thank you. And thank you, Ron, for allowing me to bring this question to the group. And thank you.
Hey, great. Now it's time for me to introduce these wonderful speakers. But first, I want to thank Michael and Mary, and of course, Libbie, Frankie, and Stacey for grounding us and setting the context for these discussions. You know, it's about real people with real experiences who are impacted by the policy decision made by our lawmakers. And so thank you for, making it real and bringing it home. We're talking about folks with lived experience and their impact. And thanks to you for coming forth with the data that's going to help facilitate our advocacy agenda. So first, a close friend of ours and mine personally, Dr. Libbie Sonnier. Libbie Sonnier, PhD, has served as executive director of the Louisiana Policy Institute since 2019. Recognized for her tenacity and deep commitment to children, Dr. Sonnier has led teams and systems-wide initiatives for the betterment of children, families, caregivers, and practitioners for more than 2 decades. Dr. Sonnier.
Thanks so much, Ron, and thanks so much to the United Way team for having me today to get to talk about my favorite subjects, which are Louisiana babies. As we face many things in this state, one of the things that we really work hard to keep central in this is our young children, particularly children birth to age 4. Next slide. And so when we talk about early care and education, one of the places that we've been able to shine in Louisiana as a state is to be able to have a conversation around early care and education being a workforce of today issue, a productivity issue of today. Next slide. And in that discussion, what we have centered it around, because we've done the research at the Policy Institute, is that a lack of access to quality, reliable childcare for working parents, it costs our employers in the state approximately $762 million a year, but it cost our economy as a state $1.3 billion to our economy of a loss due to childcare breakdowns. And that's not small potatoes. That's big money in a state that's rich in culture and rich in many ways, but we have limited resources. So we can't afford to lose this kind of money in our state's economy. Next slide. And so what we know is that without a continued investment in our youngest learners, that if we don't make investments at a substantial pace in the next decade, we will lose $12.1 billion in our economy. Versus if we can continue to make state investments like we did last legislative session, we can garner up to $1.8 billion. I've taken too many statistics courses in my life. I can't probably explain any of them, but this is simple math. We have to invest in our young children to see a gain in our economy and really make sure that we're investing in the people that we need to in our state. Next slide. And so we do that through working with partners like you all, with our Ready Louisiana Coalition. We have conversations about how do we make strategic investments in our state. And this Ready Louisiana Coalition is really a shining light to others that you can work on very disparate things throughout the state, but we can agree on young children. And we can agree on young children being a critical investment in our state with leaders on this call, economic developers, Entergy, all kinds of wonderful people that have been part of the coalition. And this coalition helped lead the pace for last session. And it's important to understand what we did last legislative session to understand where we need to go for this coming session. Next slide. And so what we were able to do is we were able to garner $44 million for early care and education in the state's budget. That is no small feat. Of that $44 million, 25 of that million went to child care assistance. So that child care assistance, those public dollars go into an accountable system for early care and education that's in the top 20 in the country. And this child care assistance money really helps families that are looking for work, working, and going to school. The additional 18 and some change went to really restore rates for our pre-K 4-year-old programs because they had been underfunded for a number of years. Next slide. Additionally, what we were able to do, which again, no small feat, this is why we work in coalition and partnership time and time again, is we were able to garner $40 million of one-time money. It was unused MFP money that funds K-12 education into the Early Childhood Education Fund. Critically important because this fund offers a dollar-for-dollar match. This dollar-for-dollar match is going to be utilized in the city of New Orleans with the recent millage passing on April 30th of 2022. Also in the catchment area of United Way Southeast Louisiana, that means that the investments that Jefferson Parish is making in their community in early care and education can be matched. And so a $40 million investment is critically important to our young children in the state. Next slide. We were also able to garner $27 million over 3 years for the Early Childhood Services and Supports Program. When you look at $84 million for early care and education, and you look at $27 million for supports and services for programs for wraparound services for young children and their families that are at risk, we were able to get over $100 million for young children in the state of Louisiana. The single most historic down payment of an investment in young children that we've ever seen in our state. So again, to just understand what we were able to do last session and where we need to go moving forward. Next slide. Additionally, we were able to work on a statute that said that if you have a certain type of juvenile justice millage, that you could use those dollars for prevention in early childhood, meaning at a local level, you can decide how you want to spend juvenile justice prevention dollars, putting locals at the helm to say, this is what our communities needs. Next slide. Additionally, we were able to expand access to high quality early care and education by working with Senator Cleo Fields that says, you know what, school districts, if you want to expand your 4-year-old programs, you need to do that in collaboration with childcare businesses, and it needs to be year-round, day long. Next slide. And we were able to also establish a revenue and compensation task force within the Early Childhood Education Commission. And this commission has helped set the pace of understanding the number of children that we do serve versus that we don't serve. Next slide. And so we at the Ready Louisiana Coalition, including many people on this call today, if we're thinking about this legislative session coming at us like a freight train in April, we are urging our leaders to invest state dollars in early care and education programs and the Louisiana Early Childhood Education Fund. And that fund is that one-to-one match during the 2023 fiscal session to ensure that we are able to maintain access to quality early learning experiences that really that our children need and that support our working families in the state. Next slide. And so again, we could not do this work without a Ready Louisiana Coalition. And what I'm about to share with you, 99 of the 120 organizations were able to sign on what the coalition is pushing forward in this legislative session. Next slide. And that is to appropriate $315 million to maintain childcare access for 16,000 children birth to age 4 as a result of expiring one-time federal funds, and expand access to high-quality early care and education for over 9,000 in need children. I want to be very clear here. We have $200 million flooding out of the state of COVID relief dollars. We have used those dollars to expand access to quality early care and education in our state. We have used these federal dollars to make sure that we prop up an early childhood system. These dollars are coming to an end, and we are in the process right now of starting to lose 16,000 children if we do not replace $200 million. These are not widgets. These are families that are working. These are families that are going to school. These are families that are looking for work. I am not one to be hyperbolic, but I need to explain that the gravity of the situation, that we have record low unemployment in our state, and we've served the most children we have served in our child care assistance program in over a decade, and the majority of them being infants and toddlers. And so that's why the dollar amount is high, because it needs to be high because we have a need. In addition to that, we want to continue to incentivize locals like New Orleans has done, Jefferson Parish and other parishes in our region to invest local dollars. And so we are requesting 10% of recognized excess revenue to go into that Louisiana Early Childhood Education Fund. Because when locals step up investing in their young children, we need to be able to match our promise. And so making sure that we have 10% of that excess funding in that fund is critically important. Next slide. We worked very hard in the 2021 legislation to talk about how the infusion of the COVID relief dollars would not make our early childhood system whole. Now we're in 2023 and these monies are coming out. And so as we talked about back in 2021, we talked about building a bridge. And right now, what we know is those COVID relief dollars are that orange piece of that graphic. And that helped us build the bridge. But that bridge is about to go in the water. And as that bridge goes in the water, that gray piece of the bridge will help support children, or the children that are yet to be served. And so if you go to the next slide, you can see that those orange babies at the tippy top coincide with the orange part of the bridge. These are the children that are being served because of COVID federal relief dollars. All those gray babies are the babies that are yet to be served. If we do not have investment in quality early care and education in this next legislative session, and all we have is our child development block grant and the current state investments in early care and education, the only children we will serve are those blue babies. So we would go from a height of serving a little over 28,000 children in our early care and education system to serving 13,000 children. We need that critical investment. We know that this is for livelihood and well-being of young children and their families. And we also know that this is an economic issue. Again, record low unemployment as we've served the most children that we've served in our system in over a decade. Next slide. And I want to live in a world where this baby and all the babies in the state light up like her eyes. And that's what this critical investment is about. So thank y'all so much for having me. And she's been our it girl for a little bit, but please reach out if you have any questions. And I'm happy to take any questions when it's time in a little bit.
Hey, thanks so much, Libbie. And of course, you have time to ask Libbie and others questions at the end a little bit later. Thanks for sharing such important information about investing in early care and education. And also making the connection between the workforce. We don't always do that. And how much money, God, 1.3 billion, Dr. Sonnier shared, is lost due to lack of childcare and childcare challenges among businesses. And what opportunities we have for an investment that could result in potentially 12.1 billion additional revenues for businesses if they make the right kind of investment in early care and education. Also, as Dr. Sonnier pointed out, there's a lot more work to be done. In fact, we're advocating for another $315 million to support and maintain what we have now. And certainly we want to incentivize local governments to invest like New Orleans did early on, becoming the first city, I think, to invest in early care and education, certainly in this state, perhaps
in the country.
Perhaps in Dr. Sonnier shares in a country. And so that model works, and that's certainly an advocacy area. Thanks again, Dr. Sonnier. Now it's my pleasure to introduce Frankie Robertson. Frankie Robertson is founder and president of the Amandla Group, LLC. Frankie has worked in public administration for more than 2 decades. Her maternal and child health work spans over a decade and began as state director of the Louisiana chapter of the March of Dimes. It's my pleasure now to introduce and to present Frankie Robertson.
Thank you, Mr. McClain. Hello, everyone. Good afternoon. So happy to be here today. I will go ahead and start sharing my screen this afternoon. And I appreciate the opportunity to be here today. So I am very happy anytime I receive an invitation to talk about maternal health. It is truly my passion, maternal, infant, children's health. So this is indeed an honor to be able to address the Public Policy Committee today. First, I would like to give a special thanks to Kylie Mayfield. She is the National Community Power Building Director with National Birth Equity Collaborative. And today I am sharing excerpts from our presentation we presented a while back at a previous policy conference. So I do want to give her credit for her work that we prepared together. National Birth Equity Collaborative is actually a client of mine through the Amandla Group, as well as March of Dimes and several other maternal child health organizations, including in the Institute of Women and Ethnic Studies. Today, I'll be sharing some slides that I prepared for one of my clients, National Birth Equity Collaborative, to discuss the Mama Plus Health Policy Agenda, which works to address Black maternal health in Louisiana. First, I would like to start off by saying that my background, as Ron mentioned, is in maternal health. I worked with March of Dimes over a decade. My focus the past decade and a half has been overall maternal health. When I started my firm, the Amandla Group, I said I would specifically focus on addressing health inequities for Black and Brown communities. So you hear me talk a lot about the state of Black maternal health. I do want to make it clear my focus is maternal health for all races and ethnicities. And one of the things that I do and I pledge to do is center the issue of Black maternal health in everything that I do, because if we address Black maternal health and disparities that are facing communities of color in terms of maternal health, we will impact maternal health favorably overall. So my focus is maternal health, but I'm always going to zone in on Black mamas, because we have to make sure that Black maternal health is at the core of what we are doing. So today I'm going to start off with an overview of the state of Black maternal health in Louisiana.
Frankie, I'm sorry to interrupt, but we're seeing just a loading screen on your slides. Would you mind maybe resharing?
Okay, let's see. Oh, it's on. Thank you. So let's see. Did it start? It says screen sharing is paused, and I'm not sure why. So I'll stop share and I will start over. I'm seeing the total screen, but then it says that it's paused. So let's see. All right, thank you.
Great.
Okay, so did we get this part? Is everyone able to see now?
Yes.
Okay.
Thank you.
Thank you very much for stopping me. So I'll go ahead and advance the slides to where we are right now. So I want to spend just a few minutes talking about the maternal health crisis in our state, because we truly have a maternal health crisis for everyone. When we look at the March of Dimes report card, which I'll share shortly, it shows that maternal health in Louisiana there's a lot to be desired, right? Our state has the nation's second highest preterm birth rate. We have the nation's second highest infant mortality rate. And there is a lot of work that has taken place in our state. We are truly light years ahead of other states, but the bar is low, right? And there's still a lot of work that we have to do to make sure that our moms and our babies are taken care of. And when we look specifically at the inequities in maternal health as it relates to Black birthing people, we can see that our Black moms aren't even getting the bare minimum that our white moms are receiving in terms of care, in terms of wellness, in terms of overall infant health, and so on. Our state has some of the worst maternal health outcomes in the nation. It also has the highest maternal mortality rate amongst other states. And one of the things that we don't hear a lot is about the issue of severe maternal morbidity. And basically, in summary, that is maternal injury related to pregnancy or postpartum period. And those instances of severe maternal morbidity are exponential compared to maternal deaths in our state. In Louisiana, Black women are 2 to 3 times more likely than white women to experience a pregnancy-related or pregnancy-associated death in Louisiana. And that information comes from our state pregnancy-associated mortality review report, which releases pregnancy and birth outcomes information each year. The majority of the cases of Black maternal mortality are preventable. That is one of the key things to remember, that our state does not even have to be in a position that we are in terms of the rate that Black women are dying during and after childbirth, or the rate of maternal injury that we sustain while we're in the pregnancy and prenatal and postpartum period. These disparities exist for Black moms, despite certain factors that would usually be identified as protective factors. There is a research report that was released, I think it was the latter part of last week, that talks about Black women of higher income, higher socioeconomic status, actually having some of the worst or the highest worst outcomes when it comes to pregnancy-related death. A lot of people are shocked by the findings of the report, as we should be. We should not just be shocked, we should be enraged. The issue is that report and those types of findings aren't new. We've known for a very long time that socioeconomic status, income, and things of the like are not protective factors for Black moms. As a matter of fact, Black moms who have higher degrees actually have worse pregnancy outcomes than moms that do not have degrees or lower level degrees. So we'll get to some of the root causes of this, but those, as those reports are released, we shouldn't just share them. We shouldn't just say this is awful. We should all be in the front driver's seat, at the front row of finding out how we can make a difference, because this issue is impacting all of us. Black moms who are college educated, as I mentioned, fare worse than women of all races who've not finished high school. Even when we look at things associated with obesity, and our state has some of the highest obesity rates, obese women of all races have better birth outcomes than Black women who are normal weight. There was also a study that was released many years ago that talked about Black women who were living in predominantly white neighborhoods or white economically affluent neighborhoods who fared worse in terms of birth outcomes than Black women who lived in neighborhoods that were struggling financially, and white women who lived in poor neighborhoods. So when we look at some of the root causes here, we know that it has mostly and everything to do with racism and not necessarily race, as Dr. Joy Career-Perry has shared in her talks about maternal health for many years. What you're seeing right now is the Louisiana Preterm Birth Report Card. This is released by March of Dimes every November. Our state, since this report card has been released, has consistently had an F. Since this report card was developed. I think it was in 2008 when the first report card was released. Now, given our state has had some improvements, as you can see with the timeline here and there, we are still a work in progress. And many of the investments that have been made in our state have been helpful in many regards. But again, we have a long ways to go to make this state a healthier place for birthing people, for moms, and specifically for Black women of childbearing age. We can also look at the infant mortality rate. It has fluctuated over the years. We're pretty much back and forth with Mississippi and Alabama in terms of who has the highest infant death rate. I also want to just share, just to define preterm birth. Preterm birth is the birth of a baby before 37 weeks gestation. A full-term pregnancy is about 40 weeks. Between 37 and 40 is going to be full term, but a full term pregnancy, as we know, is 40 weeks. Infant mortality is the death of a child before their first birthday. Also, if we want to take a look at preterm birth rate broken down by race and ethnicity, we see that Black moms have the highest preterm birth rate in our state at 16.6%. Followed by American Indian, Alaska Native, and then Hispanic moms and Asian Pacific Islander moms as well. In Louisiana, the preterm birth rate amongst Black women is 55% higher than the rate amongst all women. And I'll share with many of you on the call who know me and know my work. I've shared this before, but I have two children. I have a son born full term, and I have a daughter who was born at 28 weeks gestation. And this is with me having 12 years under my belt working for March of Dimes and not having any of the protective factors that might apply for women who do not identify as Black. Outcomes for moms and babies are impacted by a myriad of issues. Most notably, we talk about social determinants of health and looking at those issues that are impacting our day-to-day existence as just people just trying to go about making a living, and also looking at the life course, which we cannot ignore because pregnancy outcomes, birth outcomes, healthy children, and the things that are needed to foster wellness and wholeness, they start long before the preconception time frame, and they certainly start long before one is pregnant. So we have to be mindful of those things. I'd also like to share one of the things that we're working on is addressing maternity care deserts. March of Dimes released a report, I think about 5 years ago, their first maternity care desert report. And basically it's a snapshot of counties or parishes that are absent of obstetric care providers in our state. And this is a map that shows you the rate, the amount of obstetric care providers in our state. Obstetric care providers would be considered an obstetrician, a certified nurse midwife, or a certified midwife. And as you can see, this map color codes this issue, and you can see exactly where the greatest needs are in our state. This is another map that shows you just the level of intensity with the maternity care deserts, whether it's a low access to care, moderate access to care, or true access to care as well. Local maternity care desert research was actually conducted through the Mary Amelia Center for the Women's Health Equity Research at Tulane University. That report took a closer look and identified several key things that March of Dimes highlighted in its report as well, is that women who live in the parishes classified as maternity deserts are 3 times more likely to die from obstetric causes of death compared to women who live in other parishes. And the women who live in maternity care deserts also have a 91% increased risk of death during pregnancy and in the postpartum period to any cause. Maternity care is a critical window of opportunity for prevention of non-obstetric causes, such as IPV screening and other types of intervention, including mental health and substance use screening and treatment. So it's really important. I think we can all agree that birthing people need access to care before, during, and after pregnancy, but seeing it laid out where you can actually see the parishes and see who has and who has not, it's really, really alarming. And there are policy opportunities to address these, which I will share shortly. So the next area I would like to talk about is the Mama Plus Health Policy Agenda. And listed here are the various agencies that develop this agenda and who maintain this agenda present day. It is a statewide collective of organizations that are maternal child health focused. We have National Birth Equity Collaborative, Birthmark Doula Collective, Institute of Women Ethnic Studies, the New Orleans Breastfeeding Center, and the Amandla Group, by way of me serving as their policy representation at the Capitol and also advising. A little bit of background about the agenda and how it was developed. It was developed to address the Black maternal health crisis in our state. It was loosely patterned after the Black Maternal Health Caucus Momnibus, which is a federal piece of legislation. And it also uplifts recommendations from state-led initiatives, such as the state's mortality, maternal mortality review committees, and issues identified by lay people. It's comprised of various titles, again, paralleling the National Momnibus. One of the things that I will say is that when this group formed, our commitment was to make sure that the policy recommendations that were presented from various legislative reports and state health departments, that those policies would see the light of day, that we would not allow any report that was designed to address maternal health issues to sit on a shelf and not have the strongest level of advocacy behind it. So since its inception, the past 3 years, the Mama Plus group has been working to make sure that these policy recommendations have or are crossing the finish line, to make sure that the answers that we have about why is the maternal death rate so high in Louisiana, why is the preterm birth rate so high in Louisiana, we know the answers. We just have to make sure that there's a policy in place to address these. Some of the examples of some of the things that the group has worked on in coalition with various organizations on the call today and others, they're listed here, so I won't go through them, but I will say that notably, last legislative session, we worked with Southeastern Louisiana United Way and various groups that are here to pass the maternal mental health screening legislation. Also, the previous year, developing the infrastructure needed to have doula coverage covered through private and public insurance, but then also worked with various partners here to make sure that postpartum care was extended up to 12 months. And then we continued to work on paid family leave. And we were really happy to be a part of the workplace accommodations bill as well.
Wow.
Yes.
Well, Frankie, I didn't mean to cut you off. I thought you're coming to an end.
I am, yes.
Great
and
information.
And right now, can absolutely come to an end right now. I know time is short, and I would just say that if anyone would like to engage with the Mama Plus Health Policy Agenda, you can scan the QR code here and find out a little bit more about our work. And then also would like for everyone to know that we do have a policy day coming up. It's the Black Maternal Health Advocacy Day, and just save the date, April 12th. And if you'd like more information, you can reach out and I'll be happy to share it. But thank you so much.
Thank you, Frankie, for sharing such important information. And certainly, as we listened to Michael and Mary earlier, what you talked about, hit home directly in terms of, just the disparities that currently exist, particularly in Black maternal health. I'm quite familiar with a lot of it, having worked at the first infant mortality reduction agency, Great Expectations, and currently consult with Crescent City Family Service with Mary Schulteis. And of course, thanks for bringing up the National Birth Equity Collaborative, run by our local star, Dr. Joya Crea Perry, a good friend of mine. And so just stay tuned for more from Frankie, and certainly get your questions ready, because this is a great, important topic. And I just learned about maternal care deserts, and I think we all should know about those things and the impact it has on just life and death, especially as it relates to women of color. So now we'll transition to Stacey Roussel. Stacey Roussel serves as Deputy Director of the Louisiana Budget Project. She brings nearly 20 years of experience in public and academic and nonprofit sectors, working on issues related to economic and community development, with experience in fundraising, strategic planning, program evaluation, and policy analysis. Stacey, so glad to have you here.
Thank you so much. It's always a pleasure to be with this group. I'm going to go ahead and share my screen and see if I can jump right in. Okay. All right. Are you all seeing the presentation?
Yeah.
All right. Thank you so much. So as Ron said, I'm the Deputy Director at Louisiana Budget Project, and our focus is on low and moderate income households and the policies that can uplift them. We focus on the state level, but we do work federal and local as well. And our role in the ecosystem is providing as much research and the numbers to help support the policies that are lifted up from those communities. And so we do work in close partnership with those who have already presented, and we're so, so grateful for that. So let's jump into paid family medical leave. So what is it? It's fundamentally some paid time off for extended time that's needed to bond with a new child, to care for yourself, or to care for a loved one. I think many of us have been in a situation to need to take some time off of work. And of course, 30 years ago, the federal government did make a very important step in establishing the Family Medical Leave Act, which is FMLA, which many of us are probably familiar with. And that's going to provide up to 12 weeks of leave for those same purposes. The problem is that it's woefully insufficient for the majority of Louisianans, and we'll dive into those numbers in a moment. The reason for that is because, of course, it's unpaid. And so you do have the ability to step away from work if you can afford to for up to 12 weeks for folks who qualify. So where does that leave us? We've been over a quarter century waiting on the federal government to make good on the promise of making FMLA paid. We have not gotten there. We have not gotten over the finish line on the federal level, and so states have started to act. We have now 11 states that have established paid family medical leave programs, and we'll dive into that a little bit. We also are seeing in states that are stopping short of a full program that covers private sector and public sector employees, we are seeing moves toward covering public sector employees. And some of that is happening more in the South. So let's talk a little bit about the need in Louisiana. According to our partners at the National Partnership on Women and Families, you can see that 3/4 of Louisiana employees simply aren't able to take paid family medical leave. They're not able to take family medical leave. And 66% for folks can't take FMLA. And the calculation that that's based on is truly the affordability question. So if taking unpaid time off would put a family at 200% of the supplemental poverty measure or below, then we say it's unaffordable, right? You can't make ends meet. And so the need in Louisiana is very, very real. We have about 57,000 children are born each year. The majority of those households, 71%, both parents work. That's how our state economy is set up. That's how households function. We no longer in a situation where one parent is home and the other is the breadwinner. In fact, in Louisiana, 81% of Black women are a key breadwinner in their household. And that for white women is 45%. So women are playing a very important role in our household and in our economies. But paid family medical leave is also for those who are caring for elder parents and themselves. And you can see the need there is just as great. So I think a lot of folks on this call are familiar with the benefits of paid family medical leave. I think it's important to share and talk about, but I won't spend too much time on it. The evidence, though, is very, very clear, and we're quite fortunate to have before and after studies in a number of states who have established programs to look at things like hospital admission for babies 3 months or younger with RSV. You know, we've had an outbreak in Louisiana of RSV, but most of us who have kids are familiar with it. And what they found was there's a 35% reduction in that hospital admission for states that have paid family medical leave. It's also good for moms. Many, many moms go through not only incredible bodily changes, but there is a lot happening that we need to support in mental health as well. And paid family medical leave can be a key component of that. And of course, it's good for the economy. It helps women stay connected to the workforce. And so if women in Louisiana did have access to this benefit and were working at the same rate as women all over the world in developed countries and some of our partner countries around the world have paid family medical leave. The United States is the outlier. So we could have 100,000 additional workers, 95,000, and 2.6 billion more in wages if women in Louisiana could work at the same rates. So as we think about what's happening at the state level, paid family medical leave, we have some legacy programs that have provided some wonderful data. California, New Jersey, Rhode Island, all of those programs are 1 and 2 decades old. And then you can also see that really right before the pandemic and during the pandemic, a number of state legislatures also took actions to enact paid family medical leave programs for their states. So what about Louisiana? What is our journey? Where are we going? You know, there's certainly discussion and work that came before, but I'm going to start at 2015 and just recognize the leadership that Tulane, again, the Mary Amelia Williams Center hosted a wonderful discussion on paid family medical leave, and that catalyzed legislation that was introduced in 2016 to establish a paid family medical leave program. It did not pass, unfortunately, but we have seen a number of steps being taken at the Capitol. So in 2018, we had the Healthy Moms, Healthy Babies Advisory Council by Representative Hilferty, which did result in a number of recommendations, including paid family medical leave for the state. We've also seen a request and a wonderful report by the legislative auditor that's looked at this benefit for public employees in Louisiana and found that it is a patchwork of benefit that's truly insufficient and too often relies on just who your manager is as to what your leave benefit is going to look like. And then we saw in 2019 another attempt to establish a paid family medical leave program, which did make it out of its first committee, but did not go further. And then from there, we saw a task force created, which I just want to recognize March of Dimes and our other partners that were members of that, to outline what could a program look like for Louisiana. And then the following year, we were really the first in the South to appropriate dollars toward an actuarial study that would be contracted to look at, well, if you run the numbers, what does it really cost? What would it take in Louisiana to do this, to make this happen? And of course, I have to recognize that the landscape for women has changed fundamentally with the Dobbs decision. And the way that that impacts the need for a benefit like this. And so here we are today. We are working very closely with the actuarial firm that Louisiana Workforce Commission has contracted with to model out what could this program look like for Louisiana. And so, of course, there's an entire presentation that I could do just on that study, but I do want to share with you that we're looking at results coming in the next couple of weeks. And we're looking at a series of different benefit models. So if we were kind of on the lower end and provided 8 weeks of leave, what would that cost? If we were right in that alignment with FMLA and provided 12 weeks, what would that look like? And then if we could really stretch a little bit, do a little more for our moms and for our families, what would 16 weeks look like? And I can tell you from analysis that we've done several years back, that generally what you see around the country is that the weekly cost of supporting a paid family medical leave program through payroll contribution is about the cost of a cup of coffee. It's going to be a few dollars and change, and it's like buying yourself a cup of coffee to know that when you come upon life, when you need to care for your parents when they fall ill, or when your colleague needs to step away to bond with their new child, that you've invested in that cup of coffee and that it's available. So I just want to, in closing, share that this is an incredibly popular program in Louisiana. LSU included paid family medical leave in their state survey. And I just, superimposed those majority and supermajority lines there for you. And when you look at a payroll contribution model, which is what's used in every state that has established this program, you'll see across the board majority support, both parties independent. So statewide, you have a supermajority support for a program like this for an employee-employer contribution. So I did want to share with this group a series of resources and to also let you know that I am available. There's a wonderful coalition of organizations and individuals who are working diligently to help educate lawmakers about this policy, including hosting a series of legislative breakfasts. And I just want to give a shout out to our host today for helping to support that. That Louisiana Public Health Institute is going to be doing around the state, so that we can ensure that folks understand what's at stake and also how incredibly doable this benefit is for Louisiana.
Wow, Stacey, thank you so much for this wonderful presentation. And just to kind of making it clear, there's a huge difference between paid leave and unpaid leave. In fact, the unpaid leave, according to Stacey, is just inaccessible when you consider the large numbers of households who need that income. And quite frankly, many where the women are the primary breadwinners, some 80%, 81% of Black families, African-American families. And so thanks for bringing it home and how important it is to continue to advocate for support for families during this critical time. And we do appreciate, I guess, that there is unpaid leave, but unpaid leave doesn't quite make it for many of our families, particularly Alice households that we're focusing on so much. Thanks again, Stacey, for a great presentation. Now I'll transition into some homegrown heroes. First, Jillian Delos Reyes. Jillian has served 3 years in her current role as Director of Youth and Education Initiatives for the United Way of Southeast Louisiana. Within this role, she manages the New Orleans campaign for grade level reading, which focuses on building equitable opportunities for children centered on the main drivers of grade level reading success: school readiness, summer learning, and attendance. Without further ado, Jillian Delos Reyes.
Thank you, Ron. Can everyone see my screen all right? All right, awesome. Well, thank you for this opportunity to meet with you this afternoon and talk about some of our policy priorities for this new year. I just want to start with like a special shout out. So the New Orleans campaign for grade level reading was a head and heart investment originally made by Michael Williamson in our United Way, and Ron McClain of Institute of Mental Hygiene back in 2014. The campaign was relaunched in 2017, and I'll bring us up to speed on what kinds of policy wins we've made to date. But this campaign would not be, it is now an internal initiative of United Way, but it would not be in existence without the investments of United Way and IMH. So currently our challenge is that only 34% of our New Orleans third graders are reading on grade level. You know, pre-pandemic, we were able to increase that up to 36, 37%, but because of like the learning loss that occurred during the virtual learning spaces, that number has decreased. So we have a challenge ahead of us. And the vision of the campaign is that all of our students in New Orleans are reading at grade level by the end of third grade. It is a critical turning point in a child's development where a child should no longer be learning how to read, but reading to absorb and analyze new information. So if a child is behind by the time they reach third grade, it's more than likely that they're going to be behind for the rest of their educational track. The New Orleans campaign for grade level reading, I am one representative of many organizations that make this collaborative. It's cross-sector that includes representatives from our local governments, private sector, and our business, our local businesses, educators, families, our nonprofit advocates, and our parents that are committed to working together for this next decade or so to close this gap. We are one community across over 400 communities across the United States, Canada, and the Virgin Islands that are committed to closing the gap on grade level reading comprehension equity gaps. We are the only grade level reading community in the state of Louisiana currently. So we're beyond just the region. Like, we are the only collaborative across the state that is focusing specifically on these grade level reading strategies, which I'll talk about in just a moment. But the core center of our power is around convening, collaboration, sharing resources, and activating advocacy platforms. So we are really focused on mobilizing cross-sector partners to support coordinated strategies. We create internal initiatives to fill identified gaps for our local community. We connect with local experts to programs that need them and to help us be more informed about our work and how we can improve our work. And also convening and increasing community awareness and understanding of what's working and what's not working. Ron mentioned this in my intro, but the three primary drivers of grade level reading proficiency, are centered on these three drivers: improving school readiness, so that ensuring that our children are entering a traditional school setting like K through 12 ready to learn. So this really addresses our children birth to 5. Reducing chronic absence so that children in New Orleans are in school learning. And I want to talk about this. I'll talk about this a little bit later, but chronic absence does not just mean truancy. Chronic absence speaks to the system level and community level factors that keep a child out of school, and making sure that our families have the resources that they need to get their children in school. And lastly, promoting summer learning to ensure that we close the learning gap, or the slide that we call it, that occurs between the end of one school year and the beginning of the new one. Since the onset of COVID-19, we're not just talking about a summer learning slide, we're talking about a COVID-19 slide and closing a significant gap in learning that has occurred these past 3 years. To just give us a quick recap of what we've been able to achieve in 2022. And again, this is a lot of work that has happened between 2014 to now with the investment of our partners. Louisiana Policy Institute, Libbie and her team are one of our key partners. Ron McClain and IMH have been key partners that have brought us to this place where we can even talk about some of these policy wins. But most notably, in last year, we were able to pass a dedicated early education millage in Orleans Parish that will support the advancement and growth of seats. And when we say seats, it's access for a child to a quality early center for the next 20 years. So we're projecting about $21 million in annual funding over the next 20 years. So to significantly close the gap in access for our low-income ALICE families that need quality, affordable childcare. We are also advocating for the deployment of federal relief funds or liens to support our early education system in Orleans Parish. In addition to securing an early education millage, we were also advocating to secure and keep the $3 million in the city budget that we had advocated for over the past several years. We started with a $750,000 investment in 2018. We were able to triple that up to $3 million, and we were able to secure that with our partners with the Office of Youth and Families and the Mayor's Office. And it's really cool. I'll talk about this in just a minute, but the $3 million is going towards investments in early education workforce development, attendance strategies, as well as our internal summer literacy program. We were also a support partner for our folks that are doing statewide advocacy work to help secure the $84 million in the state budget via the Ready Louisiana Coalition, and Libbie did a fantastic job talking about what the coalition is up to. And then for point number 4, this past year we were able to list CDAs and certificate trainings with the Louisiana Workforce Commission as an eligible use of Workforce Innovation Opportunity Act funds. So we petitioned with the Workforce Eligibility Board to have access to these WIOA federal dollars so that these dollars can be used towards CDA trainings to help create an easier pipeline for folks that want to join the early care sector workforce. And then lastly, we just completed year 1 of the JP Morgan Chase Advancing Cities grant. So the New Orleans campaign for grade level reading was instrumental in identifying, securing this grant, and then helping form the collaborative, which we now call the NOLA Cares Collaborative. And that stands for Creating Access, Resource, and Equity for our Black and Brown women in community. So the Advancing Cities grant is issued every 3 years from JP Morgan Chase Foundation. And it is a three-year, $5 million investment. And we were one of 6 American cities that were chosen for this opportunity. And our collaborative has partners represented in our speaker panel today. But the focus of this is to create economic opportunity and advancement for Black and Latinx women that are working or rely on the early education sector and workforce.
Thanks so much.
Oh, sorry, just a couple more things, Ron, sorry. So just talk about like where we're headed in 2023. So we have 5 key policy points, and I know we're limited on time, so I'll keep us moving. But for our first policy priority is increasing the voice of Black and Latinx women caregivers and policy that impacts them. So speaking to Mary Ambrose's DEI question about like how do we make sure that we're creating authentic partnership and advocacy with the folks that are most impacted. So our objectives around this policy one are to continue to increase the voices and participation of these voices in our collaborative and our advocacy work, increase the parent and provider representation in local and state boards and commission, and support engagement of Black and Latinx women caregivers and advocacy through our city council, state legislative session, and statewide elections. How we define this win would be an increase of parent provider participation in this specific working group for our school readiness working group, and also like have a seat at the table for increased parent and family voice and knowing with their parent organizing committee. Increase the parent and provider representation on other boards and commissions. And one thing that is currently underway is working with the New Orleans Children and Youth Planning Board to create a parent representation commission. So there's a youth commission that's being launched this year, but we recognize that there's an opportunity for parents and caregivers to have a seat at the table as well. And then finally, as we all know, there is an upcoming gubernatorial election. And so this is an opportunity to have candidates make public pledges in support of the Go Far Louisiana platform, which is a statewide initiative to ensure not just access, but a stable early education workforce. Our second policy point is centered on to continue to increase funding to expand access and better cover the cost of quality care with a well-compensated workforce. So, the increase of seats and the number of quality centers are only as good as the supported workforce that makes these centers run. So, one of the objectives we have under this policy point is to work to prevent the loss or replacement of public funds. So we're talking about, Libbie had that wonderful graphic, or pretty stark graphic, about what's at stake in terms of federal dollars that, could be lost, and the 16,000 children that are at risk of losing access to seats. We also want to ensure that the $3 million that we've secured in the city budget either, is maintained or increased. We also want to increase the sources of available sustainable funds through the Early Education Fund. So we're talking about the dollar for dollar state match, which was a critical talking point when we were, educating community about the local millage. For every dollar that's invested on a local level, the state has pledged to match that dollar for dollar. So essentially that $21 million of local revenue could be doubled with this investment. And a key point of this is also, increasing compensation for our early childhood educators, and supporting effective implementation of the universal home visiting in New Orleans. For the home visiting in New Orleans, the pilot for this was passed, but now we're talking about implementation. Like, what does that look like? So making sure folks that are staying committed to what they promised. And just a couple more points. And so policy point number 3 is increasing workplace supports and protections for Black and Latinx women caregivers. So this really speaks to the work that Stacey's doing around paid family medical leave at the local and state levels. We're hoping to work with Louisiana Budget Project more deeply on this issue, and as a main focal point of the policy areas that United Way is going to be pursuing this year. And then also support the effective implementation of the 22 workforce related wins. So it's all, the WIOA funding processes, the workforce playbook, which talks about ways that families and employers can work together to find ways to have affordable childcare, as well as paid family leave.
Thank you so much, Jillian,
sorry,
for sharing such helpful information about grade level reading, and also how important it is to continue to make investment to expand the availability of quality childcare and support for families. And we'll have some time to revisit Jillian and the other speakers during question and answers. I want to move right on to Melisse Meza, who's another star in the United Way staff. And Melisse is the Vice President of Community Impact for United Way of Southeast Louisiana, where she focuses her energy on their health work, including that of the Mental Health Collaborative and the SAMHSA Recast Grant, as well as their fund distribution process. Melisse.
Thank you so much, Ron. You're very generous and gracious with your introduction there. So I'm going to be speaking to mental health and how it really connects and relates to all of the other panelist presentations today. So as many may be aware, the World Health Organization defines social determinants of health as people grow, live, work, and age. They also include factors like socioeconomic status, education, employment, and social support networks, as well as access to healthcare. And I'm sure that none of this is new, and that you actually heard all of these topics discussed in the earlier presentations. So the impact of social determinants on health can also be said for mental health. In fact, health and mental health determinants are interdependent. So you can't expect a community's health to improve if its mental health doesn't, and vice versa. So the social determinants of health and mental health go hand in hand with health equity. Once again, referring to the WHO, risk factors for many common mental disorders are heavily associated with social inequities, whereby the greater the inequity, the higher the inequity in risk. So what do we know? Regarding social determinants of mental health, social determinants have complex impacts on mental health. So people experience better outcomes when providers and community leaders use social determinant interventions. Protective factors are as important to consider as risk factors. So the spectrum of social determinants of mental health isn't limited to risk factors alone, which are more likely to lead to negative outcomes, but protective factors, which are more likely to lead to positive outcomes are just as important to understand. And class, gender, and race, which in turn affect factors like social norms, residential segregation, language barriers, also function as social determinants of mental health. And it's true that moments of crisis cast a harsh light on existing systems of inequality. In the aftermath, however, there exists a real opportunity to create solidarity and resilience. It provides an opportunity for the community to come together to provide preventive strategies and services so we have an improved health and mental health of all of our community members. And that is how the New Orleans Mental Health Collaborative was born. So the New Orleans MHC was created to identify and fill gaps in mental health care in the city. The initiative was launched during a special session, a city council session on mental and behavioral health convened by the New Orleans City Council member, Joe DeRusso, on September 15th of 2022. We found that between the COVID-19 pandemic, major natural disasters, economic insecurity, and pervasive community violence, all social determinants, it's no surprise that the mental health crisis in New Orleans has only worsened in recent years. In our city's mental health providers, they work tirelessly to support as many residents as possible and to improve these outcomes. There's a number of studies, a number of plans, including that of the New Orleans Community Health Improvement Plan for the city, the New Orleans Youth Master Plan by the Youth Planning Board, other research plans and strategies to improve behavioral health outcomes citywide. But to create systemic change, we need alignment of all of our work and we need funding. So with United Way serving as the backbone, Council Member DeRusso and Dr. Rochelle Dunham, who is the Executive and Medical Director of the Metropolitan Human Service District, they serve as co-chairs of the collaborative alongside with the leadership of its steering committee to establish a common vision, provide direction and guidance of what this collaborative will be doing. The steering committee was specifically designed to represent the city as a whole. We have leadership from academia, pre-K and secondary ed. We have representation around addiction, business community, community-based organizations, city government, the disability community, the faith community, foundations, the Hispanic and Latinx community, the insurance component, the LGBTQ+ community, and those with lived experiences. It was very, very important to have not only the usual suspects on this committee, but also those communities who were most vulnerable and those with poor social determinants. The Mental Health Collaborative has already secured a $1.9 million grant from SAMHSA to provide 2 years of funding, to support our resilient, equitable systems for overcoming loss and violence everywhere, also known as RESOLVE, and which focuses on providing trauma-informed care to youth and families living in communities of chronic poverty, most impacted by collective trauma and community violence. So not only does this grant provide us with funding to fund service providers, but it also provides us with funding to increase capacity of providers to provide that trauma first aid. So while relatively a young collaborative, we've had a strong start and we have a long way to go, identifying resources and gaps in service, barriers to care, the policy impact, increased capacity of providers, etc. Literally, lives are at stake, literally. And every time you pull up the newspaper, you pull up any news article, mental health is just such a pervasive impact on our youth who are dying, as well as our family members and our community members as a whole. But we're up for the challenge, and if interested, we welcome you to join us for this important work. So thank you.
Yes, thanks. Thanks so much for sharing such important information about the Mental Health Collaborative and the social determinants of mental health, which is really important. We don't always think about Also, this collaborative has the potential to do significant work, and thanks for sharing this. And I would hope that everybody would stay tuned for more information to come out about the collaborative. We now want to start a process for questions and answers. We don't have a whole lot of time, but if there are any pressing questions for any of the panelists, please feel free to ask.
Ron, we did have one question from Mary Ambrose.
Okay.
For Stacey. So she said, regarding paid leave, are employees allowed to take more than one instance of paid leave during the year, or is it one per year?
It's a great question. Each program is set up with its own parameters, but generally you have two thresholds. You have a maximum amount of leave for an event if it's bonding or illness. Tends to be the same, but it could change. It could be slightly different. Maybe the number of weeks might be a little different. And then the second threshold is the maximum amount of combined leave over a 12-month period. So generally, let's say you have a child, you're able to step away from work for, let's say, 12 weeks. And then later in the year, you find that you need to care for a parent. You could use both leaves, but you wouldn't be able to go above that second threshold of combined leave time.
Thank you, Stacey.
Absolutely.
Okay. Looks like we have another question from Pam Allison. Pam would love to learn more about what resources are currently being gathered to positively impact minority communities who are the current members of Pam. Did that get it? Anybody learning about resources available to that are currently being gathered to positively impact minority communities?
I think a good I'm sorry, go ahead, Frankie.
I was just going to say, from a maternal health standpoint, one of the things that's been helpful is there is a clearinghouse of maternal health support providers, such as midwives and doulas, particularly Black doulas. And that's a resource. I can place it in the chat if anyone is looking for maternal health resources.
Thanks, Frankie. Thanks so much, everybody, for being here and for contributing. I'm sorry we were kind of, had a challenge with time. And that happens when you have such great speakers and such interesting topics. Stay tuned for the next two sessions. Mary has the very next one on. And I will punt now to Charmaine Caccioppi, our fearless leader, and who challenges me as Public Policy Committee Chair, and certainly as a major mover and shaker in terms of policy discussions in Baton Rouge and the Beltway in DC and beyond. Charmaine, thanks so much for your leadership. And you're on mute.
Thank you so much, Ron. And I would be remiss in not acknowledging how privileged we were to highlight our internal experts on the United Way team. But more importantly, my God, Frankie, Stacey, oh my gosh, Libbie. These are my heroes, and we're tied at the hip at the state legislature. And I want you to know that it's not during session only. We are tied at the hip year round because this work never ends. And I just want to express my sincere appreciation for your accepting our invitation. Your input and your expertise in your respective areas is just so valuable to us. But I'd like to say you're in for a treat. Please join us on Friday, everyone that's participated today and beyond, because we will have the educational session focusing on domestic violence, sexual assault, and human trafficking. And Mariah Walensky, Kim Sport, Morgan Lamondra, Dr. Dana Hunter will all be our expert panelists for that interesting session God bless you for your commitment to United Way, for your participation in the policy and advocacy work that we are honored to do each and every day. And I hope you will continue to serve alongside of us as we advance an agenda to not only serve Alice, but to build a thriving Louisiana for all citizens. Thank you and God bless. Happy Valentine's, everyone.
Much, Charmaine. Happy Valentine's Day to everyone.